My name is Brittany Zwischenberger, and I'm an adult cardiac surgeon at Duke Health. My practice focuses on patients with coronary artery disease who need surgical revascularization with CABG, or coronary artery bypass grafting, and valve surgery. When I see the patients, I've usually reviewed their medical record extensively in their studies, and then I spend my time at the bedside to understand their perspective, their experience, their symptoms, what brought them here, and what they're able to do on a daily basis. So I know what our baseline is and where we're trying to get back to, or even better than. If they need a surgery, then we'll talk about what's entailed with the surgery, any preoperative studies that we need, their hospital experience, and their post-op course and what to expect. The most gratifying part of my job is really the restorative nature of the surgery that we do. You know, we're trying to get patients back to where they were maybe weeks or months ago. When they started to notice a little bit of change in what they were able to do, maybe they thought, oh, I'm just getting older, but in fact it was an actual disease that was really hurting their heart and making their heart pump less efficiently. And I'm very proud and very gratified when we can get the patient through the surgery, and then they can start with physical therapy and rehab with our expert teams of physical therapists and get back to walking. And then I see them a couple of weeks later, and they're just really surprised with how far they had backed off what they love to do, and they're able to get back to that and enjoy life more. And I definitely love to hear back from my patients years down the line and hear about how they're doing and how they've just continued to enjoy life more.